You are called to a local residence for a man who is ill. You arrive to find a 56-year-old man lying in a recliner. Family states he has been sick with flu-like symptoms for a few days. He started having difficulty breathing around 8 p.m. last evening and is now complaining of a fever.
Okay. PPE, is my scene safe?
Scene is safe.
Okay. Mechanism of injury seems to be flu-like symptoms, and he had difficulty breathing last night, and he has a fever. At this point, I would not consider C-spine. I would call for ALS, and I only have one patient, correct?
Yes, one patient.
Okay. My general impression is a 56-year-old male lying in bed with difficulty breathing. Sir, can you hear me?
Patient is responsive.
Okay. Patient is responsive to verbal stimuli. Chief complaint, can he answer the chief complaint? Is it just difficulty breathing?
Yes, he is having troubles breathing and stuff.
Okay. Airway, we're gonna move on to airway. First, I'm gonna open the patient's airway and make sure that it is open and nothing's in it.
Airway is patent.
Perfect. Next, I'm going to listen for blowing sounds.
Okay.
Do I hear anything?
You hear rails at the right side base of the lungs.
Okay. How many breaths per minute is he?
He is at 26 breaths a minute.
6. And is there adequate chest rise and fall?
Yes, and there is intercostal retractions.
Okay. All right. Can I have an SpO2?
SpO2 is 92% on room air.
Okay. At this time, I would put a non-rebreather mask on my patient at 15 liters per minute.
Okay.
Circulation. Does he have a pulse?
He has a pulse. It is 108 beats per minute.
108. Okay. His skin is at pink, warm, dry.
Skin is pink, warm, and dry.
Pink, warm, and dry.
I forgot to add pulses are strong and equal.
Strong and equal. Okay. Is there any major bleeding at this time?
No major bleeding.
No major bleeding. Okay. I'm going to initiate transport because he is having trouble breathing. Now I'm going to take history on the patient if he's able to answer me. OPQRST onset. Can he tell me when and how the symptoms started?
Symptoms approximately started 12 hours ago at about 8 p.m. last night.
Okay. Does anything make it better or worse?
On inspiration, he has pain to the right side.
Okay. Can he describe the pain to me?
Patient states it as a dull, achy pain.
Okay. Can you show me where the pain is located?
I would believe it is on the lower right side of his lungs, with no radiation.
Okay. Severity, can he tell me on a scale of 0 being the least, 10 being the most, how the pain feels to him?
Patient rates it at a 3.
A 3. Okay. And time, how long has he had these symptoms for?
About 12 hours.
12 hours. Okay. Now, so he has been sick for about 12 hours, got sick about 8 p.m. dull achy pain to the lower right side, and a 3. Okay, now a sample. Any other signs and symptoms besides the dull pain, fever, flu-like symptoms, anything like that?
He is hot to the touch, and patient says he cannot take a deep breath without pain to his right side.
Okay. Does he have any known allergies?
No known allergies.
Any medications?
He has been on Cefazil for 3 days for patient states that he is compliant with the medication.
Okay. Past pertinent history.
He's had flu-like symptoms for about 3 days.
Okay. Last oral intake.
He hasn't eaten anything for about 2 days.
Any water, does it say?
Does not state any water.
Okay. An event leading up to this.
He was just sitting in his chair watching TV.
Watching TV, all right. Okay, next I'm going to do my secondary assessment. I am going to do cardiovascular, listen to his heart, see if I can hear anything abnormal. Do I hear anything abnormal?
No.
No, okay. I would also do pulmonary, listen to his lung sounds once more.
Still just rails on the right side, at the base of the right side.
Okay. I would expose the chest, look at it. I would probably palpate it to see if there's any discomfort anywhere.
Just pain to the right side.
Just pain on his right side, okay. I don't think I would do anything else for that, so I'm going to go on to vital signs. I'm going to take a pulse again.
Pulse is still 108 beats per minute.
Okay. I will respirations.
Still 26 beats or breaths per minute.
Still okay. Next, I'm going to take a blood pressure.
Blood pressure is 148 over 68.
148 over 68. Okay. Is his chest rise and fall still?
I believe it is still the same. Still intercostal retractions.
Okay. So my field impression is we have a 56-year-old male patient with flu-like symptoms. He's having difficulty breathing. He's had a fever. He has rails on the right side of his lungs. 26 breaths per minute, SpO2 of 92. He's pink, warm, and dry. The pain is dull and achy. He's not allergic to anything. He has been taking his medications. He's had the flu for the past 3 days. No food for 2 days. My treatment would be transport the patient in a comfortable position for him. I did initiate oxygen at 15 liters per minute, and I would continue that. And I would reassess him every 5 minutes. And arriving at the hospital, I would do a detailed report to them about the patient.
Is there anything that you would like to add or subtract?